Hi, I'm Dr. Tiff here with Integrative Pediatrics and Medicine in Studio City. And today I'm here with my friend, Dr. Allison Adams. Dr. Adams is the founder of Chiro Life Family Wellness in Beverly Hills, and she holds a doctorate in chiropractic and specializes in athletic injuries, pregnancy, and pediatric care. So thank you, Dr. Adams, for being here.
Thank you, Dr. Tiff. I really appreciate you having me on, and I look forward to our conversation. Love it.
Absolutely. I know a lot of our patients, are interested in alternatives to traditional, conventional medicine. And, chiropractic is a very interesting option. And so can you tell us a little bit about what it is and what you do?
Yeah, absolutely. So in my office, I treat a range of individuals from infants that are just coming home from the hospital to 80, 90-year-olds and everything in between. My practice specializes in sports, like Dr. Tiff mentioned, and also family wellness, including prenatal, postpartum care, and pediatric care. I hold a Webster Technique certification through the International Chiropractic Pediatric Association to help pregnant moms through the course of their care and caring, and then postpartum as well. And then with kids, I just think they're a blast. They just bring so much joy into the office. And I love explaining how there's popcorn in their spines with them and getting them excited about their health and what's going on with their bodies. So yeah, it's a very gentle, very simple technique when we're dealing with children and infants in particular. It is not the same type of adjustment force as I would use on an adult individual in my office. And I like to use the analogy that the amount of tone or pressure that I use on a pediatric patient is about the same amount as I would check the ripeness of a tomato in their grocery store. Like, it's a very soft tonal technique. Because we have all these little squishy babies that we gotta work with, and they're not fully developed and formed yet. So we go to their tension and what their body, tolerates and gives back to me. I feed off of that.
That's amazing that such a gentle touch can create such change and can really
Such
help.
powerful change. Yes, absolutely.
Well, that's amazing. I know sometimes the mindset I have is like, oh, you go to the chiropractor and they're like popping things left and right, but it sounds like it's a very different technique than what you're using with the kids.
Absolutely, absolutely. And that popping and clicking sound that, chiros are famous for, you just have to remember it's just a release of gas and oxygen within the joint space. And we all are very gaseous beings. So that's naturally occurring in our bodies. But yes, when it comes to infants in particular, I don't actually probably do a manual type of adjustment until about the age of 2 or 3, depending on the child, when they're a little bit more mobile, and they're getting into trouble and
Right.
slipping and falling and things like that, and their bones are more developed, but up until that point it's just a very soft tonal technique and touch.
That's so amazing. That's so cool. So let's talk about a couple of things that come up often and how, chiropractic might help. So
Absolutely.
yeah, thank you. If we start with, babies. So, now obviously we're recommending that all babies are sleeping on their back because it's safer for them. But as a result, they're spending a lot of time laying on the back of their head. And sometimes this results in a little flattening of the back of the head and getting some interesting like head shapes, this plagiocephaly that we talk about. So is that
Yeah,
something that you see in your office?
I see a ton of it. Absolutely. And so when it comes to that particular area of the body, chiropractic is incredibly beneficial in working with the cranial bones and the sutures, because it's not until the age of 2 where they start to actually like fuse together. So there's a lot more movement to play with. And by a lot of movement, I mean like little millimeters.
Right, right.
But those millimeters make a difference as far as head shape and development and making sure the brain is getting stimulated, that there's enough blood and oxygen supply to the brain, if there's any retention of water during the birth trauma. And that's what I really try to hone in on, is the education to parents. As far as like birth is a traumatic event, like we don't remember our own births, but if you've ever watched a birth or given birth, you know that no matter which way the child enters this world, vaginally, naturally, C-section, with forceps, vacuums, you name it, it's a traumatic experience on the infant. There's a lot of pulling and pressure to the head and the neck region in particular when you're trying to get the child out. And with that can cause a misshape of the skull. And then add on, now we're sleeping more on our backs, we're not turning as much. That leads to obviously deformities there. So again, it's a very simple tonal technique. I like to go with the rhythm of the infant's breathing tone to kind of get into that to help realign the cranial bones. And it really helps because then we're getting into the cranial nerves that are right in the brain and stimulating the vagus nerve to help them calm down, get into that parasympathetic mode, help regulate breathing, digestion, you name it. So I see a lot of infants as far as that goes to try to help, whether it's maybe they're already on the helmet track, that's a biggie to help the reshaping process. But if we can prevent that, because a lot of parents just don't know a lot about it, or they don't want their child for cosmetic purposes to wear a helmet, as helpful as they might be. I tend to help a lot with that as well, in any way that I can.
That's great. And it seems like it's such a gentle technique. I mean, do babies ever sleep through it? Like, can they just
Oh yeah, absolutely. All the time.
Yeah.
Absolutely. It just depends on the individual child. If they come in sleeping, a lot of times they'll stay sleeping. Sometimes, they're ready to nurse. So I do my adjustment and I have them nurse while they're in the office. And then I go back and recheck them. Whether they're screaming, crying, or chilled out and relaxed, it doesn't matter.
That's great. And how often, I assume it's more than one treatment that you have to do to kind of work on this. You kind of have people come back frequently and get things.
Yeah, absolutely. It depends on the severity of the issue or concern at hand. And that goes for any condition that I treat in my office. Not one particular game plan is suitable for every single patient, as far as frequency and duration of those treatment plans. So it's all very individualized based care. We try to get to the root cause of what's going on with that being said. So obviously education, maybe turn them a little bit more, maybe, put a little cushion or just, hold them upright a little bit longer, depending on what's going on there, as far as like cranial work is done.
Right. And like you said, it's nice that you're able to give such an individualized approach, because I'm sure there are different reasons why different kids might be getting this plagiocephaly. If the neck muscles are tight on one side, their head can be kind of always turned to one side. And so if you can loosen things up and make their head a little more mobile, it might help a lot, for example.
Right. And that goes into the topic of like torticollis and straining in the neck and the cervical spine and the trapezius. Like, you think about it, maybe a baby loves to keep their head turned to one direction because it's more comfortable for them. So then they might get, a soft spot or flattening of that area of the head. But what's really the cause of that? Why do they want to turn their head that way? Is it because, they're uncomfortable looking the other way? Is there a vertebral subluxation is what we call in chiropractic when one of the bones is misaligned in the spine? Is there, muscular tension that's, causing and hindering that lack of movement and motion that's, obviously making the child uncomfortable? So there's so many different factors as far as that goes. And that's where I just come in to take a look and see, is it the bone structure? Was it caused during birth? Was there another trauma? Maybe there's a palate issue as far as feeding. Maybe they don't want to turn their head during the breastfeeding times because they're uncomfortable. And so that's where I come in and I look at, is occiput in the right spot? That's the base of the skull. Is there compression on that vagus nerve, irritation there that's causing them to be uncomfortable? We look at atlas and axis, C1 and C2, because that's where you'll get your rotational component of your neck. So there's a lot of different factors when it comes to that, absolutely, and they closely tie in together. If you see a child with head tilt, it's not going to go away on its own.
Right. It's so interconnected. Like, there's so many moving parts, like you said, that you need to kind of check out and make sure everything is working as it should and mobile as it should be. Yeah.
And it's putting all those puzzle pieces together, which is the fun part of my job. I love it.
Yeah. It's like a little investigation, solving the mystery for each baby.
Yeah.
And another common thing that comes up a lot with babies is colic. Colic is very annoying and unfortunately super common. So it's typically when babies will cry for more than 3 hours a day for more than 3 days a week. Right. And unfortunately, babies, we all know, cry a lot in the first few months of life, but colic is particularly bad. And even some people will say, okay, a colic cry is a little more high pitched. It'll start out of nowhere. It happens at the same time every day. There's kind of certain patterns that show up. but unfortunately we don't have a good answer as to what causes it and why it affects some babies and not others, and what we can do to like treat the root cause, but I've looked even up to 40% of babies can get colic, which is so much.
I was just going to tell you that stat. Yeah, it's unreal. Like it's on the rise as far as why we don't particularly know. But in my office, first and foremost, I obviously address the physical limitations and irritation. So that's why I'm looking for subluxations in my office if there's anything going on there that's interfering with their nervous system and how their brain is connecting to the rest of their body. And then after that, if we've cleared all those physical limitations, then I talk to mom. And I'm like, what's your diet like? Are there any dietary concerns? Then I immediately have them eliminate any allergen sensitivity type foods. So gluten, soy, dairy, processed sugars, because a lot of times it's all about developmental process. Like the baby just hasn't fully developed yet to handle those types of foods and allergens. So I find that that's usually a really big help in addressing. Sometimes the moms don't like that answer for sure.
It's hard. It's really hard to cut all that stuff out. But I agree, like in our office, yeah, we do that a lot too. And it makes a huge difference once people are able to really cut it out 100%. It can like really change the whole picture.
And even with infants that are formula fed, what type of, not all formulas are created equal. A fed baby is a happy baby no matter which way they're getting fed, but sometimes they need to be put on a different, brand of formula, a more sensitive brand to help with those irritants, because their stomach and their digestive system is just not where it needs to be at that point in time.
Yeah, absolutely. And like you said, the cow's milk protein allergy, can show up in breastfed babies, but it can also show up in formula fed babies. And so switching to a formula that doesn't have those proteins that are going to aggravate the system can be a big change. But what can you do? Like, can you work on that from a chiropractic perspective?
Yeah, absolutely. So as I mentioned, first and foremost, we look to the spine for the root cause of dis-ease. So discomfort within the body is what we say in chiropractic speak and lingo. And as far as that goes, I'm obviously going to address C1 and occiput and C2, because we have the brain stem that exits out from the brain and is encompassed within those bones of our spine. So we want to make sure that is stimulated, healthy, and good functioning, optimal functioning. And then I also do some like abdominal release to see if there's any diaphragmatic tension within the infant. We check sacrum. Sacrum and our occiput are very closely tied between the parasympathetic system. So we want to make sure that we've got no dural tension within the spinal cord that could be causing any irritation. And then of course I look to, the mid back and the thoracic spinal nerve roots to see, if there's anything going on there that could be influencing the stomach and the digestive tract.
Mm-hmm. Wow, that's so interesting, especially that working on the spine can help because, from our perspective, we look a lot at the digestion as being a big, possible cause. And so if there's spasms of the intestines not, mature enough to function properly, and that's why they're giving this pain. But yeah, it sounds like you address that, but you also address kind of these other more distant points that might be related.
Yeah, absolutely. With every spinal nerve root that you have that comes out of your spine, it goes to any cell, organ, and tissue in the body. So I kind of look to that specific area of the spine to see, okay, how is that nerve functioning? Is there some sort of interference or subluxation that I can help release to release that tension and create a firm communication line between that particular organ into the brain?
All right. Wow. That's really amazing. Have you been getting some good results? Like, are
oh yeah,
well for the kid?
Yes. And a lot of times, like the failure to thrive babies too, sometimes that's all it is. Like, it's just a simple reset. Like for whatever reason, they had a rough time coming into this world. And, we try to think it's this and this and this. And really it's just a simple, just relaxation, release of spinal tension.
Wow. The parents must be so relieved and so happy when you can kind of fix the issue and give a different.
Those mamas that come in with the colic ones are probably the most grateful out of them all.
I know it's hard. It's hard to deal with that. I mean, you're already your new mom and not sleeping and feeling like you don't know what you're doing, because no new mom knows what they're doing, to be honest. But then to have a child who's so upset and you feel, responsible and guilty, like the whole host of emotions that, that parents are going
through. And I talk to mom, like, it's not your fault. Like, you have to remember and give yourself grace too, because they will feed off of that energy. So if you're nervous wreck and really like up and in your own sympathetic dominant, mindset, they feel that. They absolutely feel that energy and will feed off of it.
Yeah, definitely. That's such a big part of it, is kind of having that calm in the household and around the frustration, to give the baby a calm root to look to and feed off of. Like,
Mhm.
amazing. So let's move forward a little bit, jump forward a couple of years, and let's talk about bedwetting, because this is an issue that we see a lot. The stats kind of say that 15% of kids who are 5 suffer from some bedwetting. And then by 10 years old, it's down to 5%. But still, like 5% of 10-year-olds is a good number of kids. And then even like 1 to 2% of kids at age 15 are still struggling with this. And so obviously there's, social ramifications. Kids feel embarrassed. They don't want to go to camp or sleepovers with their friends, and, get some feeling really embarrassed. And sometimes it's just developmental, where they have to wait and grow into it. But, I've heard that chiropractic can do a lot to help speed things along and get things working well.
Yeah, and it's more prevalent in young boys. Is what I'm finding in my office in particular as well. And when it comes to that particular system of the body, we look at the sacrum and the sacral plexus and those nerves that supply our reproductive and urinary tract organs in our body. And a lot of times, if there's a sacral shift, which is that bigger triangular kind of butt bone that we sit on, if that is somehow shifted in any way, shape, or form, it could be caused by a slip and fall injury, like the obvious things. Those are more the common situations, but emotional traumas will definitely trigger that. And so if I don't see a good release and relief of bedwetting within usually anywhere from like 5 to 9 visits, and we're still struggling and there's just absolutely no improvement, then we got to talk about the emotional component. Like, what's going on at school, what's going on socially, what's going on at home that's causing this particular child to release in this way, in this stressful manner. But typically adjusting the sacrum and getting those nerves stimulated, and making sure that they're functioning properly, and there's a good communication line. I always talk about that, the brain and the body. We're just constantly communicating and going through that flow. We can usually see some pretty good results with that.
That's great. And again, like, I'm sure the parents and the kids are so grateful, because can be a huge issue, and there's not, a lot of great other, medical treatments to do for it. So that's,
and like you said, there's a lot of embarrassment and a lot of not enough talking about it too. The parents are embarrassed, the child's embarrassed, you're not being able to go, to sleepovers, like you said, or functions. Maybe it happens during school, during a stressful situation, during test taking time. There's so many different factors to that. And that could really ruin a child's self-esteem moving forward and growing up. So that's a big one. That's a big one.
No, huge. That's amazing. It sounds like you can really, help with a lot of things. And we obviously didn't even get into athletic injuries and adults, everything else you do.
Yeah, there's a lot. And like I said, I love what I do. And the goal is to obviously help in any way, shape, or form with any patient, old or young, without the use of drugs or surgery, trying to create a conservative approach at first. There's a time and a place for it all. And I love being integrative. I'm speaking with you right now about pediatric healthcare. And I love that you are so open to the integrative mind and practice for our communities. So I think it's very important. Everything has its place and time. But as far as kids, like, they're innocent. Nothing should have happened. They've developed no bad habits, no poor posture habits. So I'm really there in those early years to make sure they're hitting their milestones. Are their reflexes, their primitive reflexes still there or not there? Like, there's certain ones we want and we don't want to see. So it's just making sure that they're neurologically developing as they should, especially when it comes to we're feeding, then we're crawling and walking. We want to make sure we're going in a proper order, because that can hinder our learning curve for the foreseeable future in a child. There's a lot of research tying into those particular milestones that we've just got to hit in time. So it's not a great thing if your child just goes from sitting to walking.
Right.
We want to make sure that the brain is connecting and we're getting that cross-crawl pattern and all of those things in between.
That's so important. Absolutely. So, we could be here all day chatting about all this stuff, but I've got to let you go, but how can patients find you if they are interested to learn more?
Yeah, so my practice is Chiro Life Family Wellness. I'm located in Beverly Hills, on the border of Beverly Hills and West Hollywood. And you can find me on my website, which is chirolifela.com, or on all social media platforms, it's Chiro Life LA.
Amazing. That's so great. It was
Yeah.
wonderful to talk to you. And again,
Thank
I'm
you so
Dr.
much for having me.
You're welcome. You're welcome. Anytime. We'll definitely have you back to chat more about other things. So, please in the comments below, let us know what you want to hear about next. And, we'll be happy to chat more about those things. So I'm Tiffany Jumaili. I'm doctor at Integrative Pediatrics and Medicine in Studio City. So thank you so much, Dr. Adams. We'll talk to you soon.
Thank you. Have a good one.
Thank you.